What if I told you that a high fat, low carbohydrate diet could actually help reverse major depression and anxiety? In today's episode of Dr. T's Wellness Emporium, we're going to take a look at some new peer reviewed research that shows exactly that. People recovering from major depressive disorder and generalized anxiety disorder through only changing their diet. Stick around. So the people in the studies we're going to look at were put on a ketogenic diet. And if you're unaware of what a ketogenic diet is, it's simply very low carbohydrate, around 20 grams of carbohydrates a day, and then high fat and high protein. And moderate protein, I suppose. It's really a high fat diet, moderate protein. So it was originally developed for epilepsy, but now it's being studied for neurological and psychiatric benefits. And so the first study we want to look at was from Calabrese et al. In 2024, and they looked at 3 adults who had treatment-resistant anxiety and depression. So conventional treatments hadn't worked for these people. They still were, meeting the diagnostic criteria for anxiety and depression. And they were put on a 12 to 16 week ketogenic diet. So what happened? Well, at weeks 7 through 12, all three reached clinical remission of both anxiety and depression. And they tracked blood ketones, they had dietitian support throughout the study, and also some community involvement. But you can look at this and say, okay, there's only 3 people. It doesn't really tell us a whole lot. That's true, it doesn't, but it does tell us something, and it tells us that for these 3 people, the ketogenic diet worked very well, and results like this, you definitely want to follow up. You want to research more and see if there's something there, because it seems like there is. Some other studies that they've done, another one from that was done in 2022, looked at 31 inpatient adults, and they saw significant drops in major depressive disorder and also psychosis symptoms. So that is very promising. We got a larger number of people, 31 in that study versus 3, also showing benefits from a ketogenic diet. Another study from 2024 showed metabolic and psychiatric improvement in bipolar and schizophrenia patients. And then a case study, so this was a single case study from 2025, and it showed a complete remission in major depressive disorder. So these are very promising results that point to a ketogenic diet possibly having major benefits for mental health. And so the question then is, well, how does this work? What's going on? So it improves brain energy. So ketones are more efficient than glucose. In fact, what happens when you limit carbohydrates to the degree that they're limited in a ketogenic diet, your body starts producing its own glucose through a process called glucogenesis. And then your brain uses that for energy. It also reduces inflammation and oxidative stress, which are both implicated in depression and anxiety. So, lowering those makes sense that we would see an improvement in anxiety and depressive symptoms. And it also balances neurotransmitters, specifically GABA and glutamate. So there's less glutamate, more GABA. So what is GABA? Well, GABA is just a neurotransmitter that has to do with feeling relaxed, at peace, at ease, just feeling overall a greater sense of well-being. Um, and also, as we saw in the one study, the metabolic health that was mentioned. So they theorize that it may support the gut-brain axis and mitochondrial function. So some things we want to consider is we can't yet or ever look at this as a cure-all. There's no panacea for anything, but this could work very well for some people. It appears to work very well for some people. You want to undergo medical supervision if you're planning on doing this, especially if you are on psychotropic medications. Talk with your doctor, your psychiatrist. Tell them you'd like to try a ketogenic diet. You've heard it could be helpful for depression and anxiety, and go on from there. And also keep in mind, as I stated before, so these are early results. They're there. We don't have an extensive body of research. They're early, but they are compelling. But there's more randomized clinical trials on the way that are being conducted right now. So we will have even more information in the future. And I'm guessing that a lot of these studies will show some significant benefits from the ketogenic diet when it comes to mental health. And if you've ever switched to a ketogenic diet and noticed an improvement in your mental health, I'd love to hear from you in the comments below. If you went on a ketogenic diet and you didn't really experience any changes for yourself, I'd also like to hear about those experiences. And if you like my content, go ahead and like and subscribe. I'm Dr. Brendan Troster. Thank you for joining me.